Exercise performance is a fundamental part of human existence. In fact, the human body is designed for the performance of exercise. Maintaining physical fitness is crucial for longevity, if we are to enjoy a healthy and fruitful life into older age.
But maintaining physical fitness is not always possible. Exercise is often impaired by disease and/or deconditioning. So how does one distinguish between the two? In the past, most patients would be referred to a specialist. Not only is that no longer necessary, but now your office can perform a comprehensive first-step evaluation of patients exhibiting risk factors. According to Dr. Christopher Cooper, director of the Exercise Physiology Lab at the UCLA School of Medicine, many patients undergo unnecessary and inclusive tests.
I find that they've seen numerous specialists in referral. They've had many expensive forms of investigation, usually cardiac investigations, and all have been non-diagnostic or failed to reveal the cause of the patient's problems. I often ask the question, how could this pattern of referral and investigation, which is inordinately expensive, be avoided? And I believe the answer to this is to empower primary care physicians, to enable them to realize the value of cardiopulmonary exercise testing, and furthermore, to bring cardiopulmonary exercise testing to their offices, where it can be performed quickly, efficiently, and safely.
In addition to being quick, efficient, and safe, this procedure must also be accurate, convenient, and make economic sense to your practice. At AccuMed of South Louisiana, the premier mobile provider of diagnostic cardiopulmonary exercise testing, we pride ourselves on providing a service that is based on these 6 principles.
Non-invasive cardiopulmonary exercise testing in the right hands is a simple technique and yields much valuable data. It is relatively quick to perform. An exercise test could be accomplished in about 30 minutes, from setup with electrocardiogram and blood pressure monitoring to the termination of the test and collection of recovery data.
What makes this procedure so efficient is that it is performed by skilled technicians, both in your office and in the Overread Center. All AccuMed technicians are college degreed and certified in advanced cardiac life support, while all data is interpreted by Viasys, an international provider of medical technology and diagnostic services.
The way this program works is that skilled providers perform exercise testing in physician offices with appropriate considerations towards monitoring and safety. The data from these exercise tests is transmitted over the internet through a secure server. Now, the beauty of this process is that the report is creatively designed, it's very rapidly developed and transmitted back to the referring physician. But above all, there is a consistency in the method of interpretation of the data.
At AccuMed, safety always comes first. We supply a crash cart, a defibrillator, and emergency oxygen for each test. These provisions, in addition to an established emergency protocol for each testing site, ensure the utmost level of patient safety.
Serious complications are reported in less than 1 in every 10,000 exercise tests, which, in my opinion, is a really excellent safety record for this type of testing performed by skilled personnel with appropriate monitoring.
In order to make a proper diagnosis, a physician needs accurate information. To achieve the highest quality results, AccuMed performs an 8-point pre-test procedure followed by a state-of-the-art cardiopulmonary exercise test, which includes the actual measurement of VO2 max. This information is transmitted to Viasys, where highly skilled and experienced technicians assimilate and interpret the data into concise and readable results. As complete and as simple as the reports are to read, there may be clinically complex results that require further clarification. In these instances, AccuMed provides free consultation with Dr. Cooper to help with interpretation of the results.
As the medical director of the Viasys Overread program, it is my responsibility to review a random selection of all tests performed, as well as any complicated tests that have technical or clinical complexity, so that we can be assured of a reliable interpretation of the data.
Although this process is convenient for the physician, it is most beneficial for the patient. The procedure is performed in your office in a familiar environment where the patient is already comfortable. Furthermore, it avoids the need for the patient to establish a relationship with another doctor. And, along with this convenience, comes better medicine.
The obvious advantages to the patients are that they have made available to them non-invasive physiological testing that can be performed conveniently in their primary physician's office at relatively short notice without long waiting times for a hospital appointment in a specialist laboratory. A program that brings cardiopulmonary exercise testing into the primary care physician's office obviously has certain benefits, the main being to empower the primary care physician in their detection of early cardiovascular disease or lung disease.
By providing cardiopulmonary stress testing services in your office, you create an additional revenue stream with minimal investment of time. This service increases patient retention and can result in additional patient visits. This is truly a win-win situation for both you and your patients.
So, in a sense, the type of information that is provided can be stratified to allow the primary care physician to decide whether to give an exercise prescription and reassurance to the patient, whether to choose more complex testing, perhaps looking for coronary artery disease, or more detailed pulmonary function testing, or whether to go directly to specialist referral, either to a cardiologist or a pulmonologist. The ability to make these determinations with data in the physician's office obviously has widespread implications in terms of the simplicity and cost-effectiveness of patient management.
In the complex world of business and medicine, AccuMed provides a scientifically sound diagnostic service that is simple to implement and easy to maintain. Together, AccuMed, Biasis, and Dr. Christopher Cooper provide a quick, efficient, safe, accurate, convenient, and economically beneficial service that improves the quality of your practice and the health of your patients.